very charming Tracy Bell. Tracy's speech is entitled "The Purpose of IDPA PCP Automatic Filing." Tracy, thank you very much.
Thank you. My speech tonight is a technical speech, and I'm going to describe the purpose of filing a PCP, automatic filing for PCP. So your first question might be, what is the PCP? PCP stands for Primary Care Provider. So why do we need to file the PCP? Well, HFS, that's an acronym, a medical acronym for Illinois Department of Health and Family Care Services, and IHC is an acronym for Illinois Health Connect. Those two entities are responsible for making sure that a patient has a medical home provider. Okay? So what that means is that they can only go see the provider within the medical home or an affiliate of that medical home. So if I'm a patient and I have Medicaid, I have to choose a primary care provider. And my primary care provider has to give the services of, he has to give 24-hour care services, and he has to and the reason why the patient has to choose the medical health, oh boy, this is not going to work. The reason why the patient has to choose a primary care provider is because that primary care provider will have to give the services for that patient, and if that provider is not that patient's primary care provider, he may not be reimbursed for services. Okay? So it became important for Rush to make sure that we know that any patient that comes to the hospital has chosen a primary care provider of Rush. Okay? So we decided, we said, well, how are we going to do that? Because if we do it manually, we see about 1,000 patients a day, for outpatient care. So we decided that we would get our system to help us identify those patients who were not part of the Rush affiliation. Okay? So how do we do that? We were challenged to find a unique way of identifying these primary care providers. Okay? And the unique identifier that we chose was the NPI number. NPI number is the National Provider Identifier for providers. Okay? But how was we going to get the NPI number? Well, we decided that we would get it through the eligibility response that we use. We have an eligibility vendor that we use for Rush so that we can send a request, and then the eligibility vendor will return a response that will show all the benefits for a patient. Okay? But we realized in that response, the NPI number was not present. So it's like, okay, what do we do now? It's not there. We actually have to call Illinois Department of Public Aid to have them send the information to the eligibility vendor in order for us to get it in the response. And who do we call? We didn't have a contact. So we decided, well, let's just start by calling the main number for Illinois Department of Public Aid. So we picked up the phone and started there. They referred us to HFS, who referred us to IHC, who referred us back to the Illinois Department of Public Aid, who referred us back to, we just kept getting the runaround. So finally, evidently, the stars were aligned, and I called the main number for our Illinois Department of Public Aid, and I actually reached someone who understood, not only understood our request, but coordinated the change at IDPA to give us the National Provider Identification for PCP. So that meant that we had to get the eligibility vendor to also send it when they receive it, which means that we had to get Epic, who is is the application we use for our registration system, to perform actions when we get the MPI number in that response. So it's like, okay, that's a whole lot of outside, dependencies. So how do we manage that, So so we asked Epic, I asked Epic, we said, we don't want to wait for the MPI number. We already know that the provider name comes in the eligibility. Let's just start there until we can get the MPI number, because we knew it was going to be a lot of channels that we had to go to in order to get that information. So I'm happy to report that after a year and a half, IDPA has changed their code to send the MPI number in the response. But now the eligibility vendor has to change their code. They knew that this request was on the table for, for a year and a half. But now it's going to take some time for the eligibility vendor to send the MPI number in the response. So we said, we're not even going to wait. We already asked Epic to give us the code for the name. Let's just proceed with making these changes, responding to using the name as the criteria. So I'm happy to say that we did put that change in, and after some analysis, we found that we're getting a 99% hit ratio, which is 99% better than the manual workflow that was in place for a year and a half. So that is the purpose and method for filing the PCP.